Maybe some clinic it might be cheaper or easier to go directly to the
Like that?
Yes, yes. Clinical doctor
How does this bit work? I didn't really understand this.
Oh, okay. Okay. Draw the point.
So what's that? What are you marking there? That's
That's the hotspot.
Yes, it's the center.
that's the hotspot.
Look,
So it's quite a way away from the sea.
that's why we don't need to measure the distance using the ruler. You can use only your hand because the hotspot is not located on C3. It may be on C3, but more often is located near. Okay? Put the coil positioning to so the drawn line, okay? Okay? And remember at which number? 3. Okay? 3. After that, this is the built-in ruler measure, okay? From hotspot parallel to the sagittal line, 5 centimeters. This is DLPFC.
So that's always 5 centimeters.
Yes. According to literature data, we need to measure from 5 to 6 and 5 centimeters depend on the size of the patient hand. But there are no literature data saying about how many I need to measure depend on concretely patient size. This is DLPFC, but we don't know how to rotate. That's no. Place the coil, the center, so you can see DLPFC, and rotate so the number 3 will be on blue line.
And why was I've forgotten about the 3. Where did the number 3 come from? It just is 3. No.
Because number 3 is the angle for the Watson. For example, for Ivan it was 2.35. Yes. It is individual size to rotate, because it depends on geometry of the patient head. Look, during motor threshold, during the motor threshold we can see 3 on the blue line. For this patient only, because for Ivan it was, for example, 2.5. Okay, that's why we rotate and draw the line. That's good. We are ready to stimulate.
Does this come automatically with the machine? You always get one of these?
Yes,
Comes a standard
but
kind of
look,
equipment?
also there is the installed F3 locator, and you can find F3 using 2 coordinates, X and Y. So you need to measure 3 distance, tragus for tragus, from inion to nasion and circumference. For example, tragus to tragus was 8. Yes, and for example circumference, for example 56. Calculate, and now you need to measure 7.9 from FPZ to the left side, and after that measure 9.2 from CZ to this point. This is F3. This is automatical F3 locator. Because to find F3 according to 1020 system, it is very difficult. Look, you need to find FPZ. After that you need to find FP1, and F3 is located at the half point between FP1 and C3. It is difficult in routine practice. So I recommend you to use, if you want to find DLPFC as F3, to use installed F3 locator. But I prefer to use coil positioning tool because I am on side of 5 centimeters rule. There are 2 approaches. Okay, so we are ready.
There are at least 2 definitions of DLPFC to start with, so everything is like so much.
Please. move the coil to the draw line.
Yeah, because the atlas is the brain atlas are the different one.
But look, this is the common mistakes. Because we match the front edge of the coil with drawn line, we make this movement and we increase the distance between center of the coil from the head. You need to move coil so that without space between coil and head.
That's a lot of real estate for
Okay.
a brain.
And look, this coil is angled. That's why during stimulation the Watson will feel muscle twitches in the face. It is not good for the patient. That's why I recommend you to use flat coil. You need, I think the flat coil is good for DLPFC and for temporoparietal cortex during stimulation, auditory hallucination or tinnitus. But
It's more difficult drawing around a flat coil, is it?
yes, and for orbitofrontal cortex for OCD2, the flat coil is the best. But if you want to treat motor cortex, this coil is the best. Okay, are you ready? Watson, I know you don't have depression.
Yeah.
Yet. Okay? Look, the magnetic stimulator, the software asks us about location of a coil.
So this will come with this as a standard coil, or do you get a choice? Do you get more than one coil with the machine?
Yes, you can select different types of coils with MG machine.
This will be the standard though, but it's usually issued or...
Yes, this is the common. Yes, the common used. But for example, for peripheral stimulation, I think the round cooled coil is the best. Because if you want to stimulate, for example, muscle on the front edge of the leg, or you want to stimulate, for example, low back during acute pain, the round coil is the best. And I know that a lot of operators in USA use TMS machine to avoid pain in the back. Because this is the classical physiotherapy, I think. Yes, the classical physiotherapy, because we use magnetic field to reduce pain in muscle or peripheral nerves, and during, for example, post-traumatic brachial plexopathy, because to use electro, yes, which is